welcome to Heads of the Vahrashee. Um, it's been a while, and we were supposed to have this yesterday, but we couldn't due to the fact that we had some technical challenges. But thank God it has been resolved, and we are back now, and we're live. So thank you for joining us. Thank you for being with us. Thank you for always supporting us and always joining the show. You're welcome, and as our custom is, before we go on, we always invite our friends and loved ones to join us. So I would love you to kindly do that right away while I also go on to share the link. So I would love you also to share the link with your loved ones, share the link with your friends, share the link with anyone that you know may love to be part of this and will benefit from this, right? So kindly do that while I'll be back in a minute. Hello and welcome back. Welcome back. It's nice to have you back. So, thank you for joining us, and I believe you've shared the links. And um, thank you. Just thank you. So, yes, we're back again at Health of Vahrashee, and today I have someone with me who I known for some time now, almost 7 years, has been my best friend. We met in school, we studied together, and we studied the same course basically. So he's a pharmacy technician like me, certified pharmacy technician like me. And you'll be talking on a topic that I love so much, any drug related topic. It's just my thing, And so I decided to bring this person on board to share with us from the depth of his knowledge, right? We do take medications every day, but perhaps you might be abusing it and you don't know. And that is the essence, right? The essence of Health of Vahrashee is to help you bring that knowledge, that enlightenment to you, to help you live a better life and a productive life at the same time, right? So live healthy, live better, live productive, right? So with me is my friend, my brother, Shapo Baba. So, ladies and gentlemen, I'll bring him up right away. So, you're welcome, Sir Baba. You're welcome. You're welcome. You're welcome, sir.
Alright,
You're welcome.
first of all, I appreciate thank you very much. Thank you very much. Um, First of all, we don't have time to we have to take a look at the so before I move on, I just want to state I think the people today, uh, I know God to do that. I feel that God will do it. So just like you have said already, just like you have said already, I think we should start to pray for a while. So today, without wasting much of time, we are going to introduction. We're going to dive into what we're going to be discussing about today. All right. So, sorry. All right. Thank you. So today we're gonna we're just going to dive into what we are here for. So today we're going to discuss about medication abuse or drug abuse. Medication abuse or drug abuse is still the same thing. You understand? Do not get confused. Drug abuse, medication abuse is the same thing. So before we move forward, let's know what drug and abuse is all about, right? Drug is a substance. When in school, they say drug is a substance other than food, right? Which we take to alters, um, the body reaction one way or the other. That is to tell you that anything, anything you eat. There is one in the history of pharmacology. There was this man. I think his name is Claudius Galen. I think if I didn't forget, he said everything you put in your mouth as food is a drug. Anything you eat that enters your mouth down to your GIT is a drug. But what differentiates drug? What the difference is the doses, the dosages you take. When you take one in a high dose, you know what's up. When you take one in a low dose, you know what's up. So everything you take is a drug because it does something to your body. That is what drug is. I'm just trying to use a layman language to explain so we can understand. And when we say abuse, abuse is an English word. And what abuse means is that trying to do something in an abnormal way. Nigerians are very good in doing things like this. Whenever they bring something, we like to use that thing in our own way. Do we feel like the way we feel it's going to favor us without minding the right usage of that thing that is being given to us, right? So when we now join them together, we're having two different words coming together, right? Drug and abuse. So we join them together, we have drug abuse. So now while joining them together, let's have their meaning as they are together. They said drug abuse is an inappropriate or an improper use of drugs in both prescription and over-the-counter drugs involve using drugs in a way that deviates from the prescribed or intended guidelines or using substance for non-medical purposes. Now, we have some keywords: improper and inappropriate. This is a synonym. And we also have over-the-counter drugs. We have over-the-counter drugs and we have prescribed drugs. Over-the-counter, we know improper and what improper, proper, improper. We're all English students, so these are words we use on a normal day. So we have over-the-counter and prescribed drugs. I'm trying to explain the term so that we will understand the the English words we use in defining what drug abuse is. Over-the-counter drugs are drugs that you can buy without prescription. Example, we have paracetamol, we have diclofenac, we have vitamin C, we have multivite, we have um, we have these blood capsules. All of them, they are over-the-counter drugs. And also, prescribed drugs are drugs that you can only get them from the practitioner or from a pharmacy store or from wherever they are selling drugs. You can never get those drugs without prescription. Number one, we have codeine. Number two, we have the hydrocodone, which is popularly known as DF 118, DF 118. I think DF 118. We also have tramadol. We also have, I mentioned the hydrocodone. We also have cocodamol. We have them a lot. We have morphine. They are very much so. This example of drugs that we cannot get them without prescription. And the reasons for not giving you out to do giving those drugs out is for your own good. So don't see us as bad people because we refuse to give it to you. I don't want to dive into that because that one is a different topic of discussion on its own when it comes to drugs. Now, there are some situations that when we find ourselves doing such things, sometimes you may be practicing it without knowing that you are abusing the drug. Sometimes a lot of people see it as a normal practice, in which it's not a normal practice. So we're going to look at those situations so that you will know if you are a victim. You know that you have to stop because you are abusing the drug and it's not healthy for you. Before we get to that, we have some important um, we have some important we have some important terms that I would like to explain briefly for us so that when we go to explaining other and those situations that are seen and termed as drug abuse, as abusing drugs, it will be easier for us to understand. Number one, we have addiction. Sorry, sorry. Number one, we have drug dependence. Now, drug dependence, it is when your body becomes used to a drug and needs it to function well. As the word implies, dependence. When we say dependence, it means you fully depend on something, and when that thing is being taken out of your way, you fall down. So it is a situation whereby some people are fully dependent on drugs, those drugs they are taking. You understand? Obviously, their body cannot function without the drug. So their life depends on that drug. And we have victims of such. That is what drug dependence is. So that we have the differences. Drug addiction. This is when you can't control your body. You can't control your drug use, even when it harms your life. It involves a strong desire or craving for the drug and lose control over using it. It can be challenging to quiet using the drug. Now, drug addiction is a situation whereby the drug you are seeing the negative effect the drug is doing to your body, and there's nothing you can do because you are so addicted to the drug. Your body is so used to that drug, so you cannot live without drug. That is what drug addiction is. Now, drug tolerance is a condition where your body will need an additional strength to attain the same effects of the doses you normally take. Now, if you are, that's why sometimes I used to advise patients, do not think, do not assume. Try and make sure you adhere to the instructions your health provider gives you on taking a particular drug that you've been taking. If not, you fall a victim of tolerating this drug. Now, what is drug tolerance? What is drug tolerance? Now, drug tolerance is a situation, like I said, a situation whereby your body can no longer be satisfied with the normal doses you are taking. Now the body needs an extra strength added to the one you were taking before to give you the normal effect you needed in your body. Seems like you don't understand. The English is too much. Okay, let me break it down. It is a situation whereby, let's say for instance, you're taking 2 milligram, you're taking 1 gram of paracetamol to feel okay, right? Now, you use that drug, you abuse that drug so much that the body is tolerating the drug, that 1 gram, you feel small headache, you take paracetamol, 1 gram, small headache, you take paracetamol. Now your body became used to it, right? That your body will need an additional strength, probably 1.5 gram, that is 1,500 milligram, to be able to attain the effect, to be able to cure that headache that you normally feel because you abuse the drug, you do not use the drug in a normal way that you're supposed to use it. Sometimes when you feel headache, it's not always advisable for you to start taking paracetamol. I, as a health practitioner, I don't even know that sometimes I'll be sick and people will be like, why can't you take a drug? Sometimes I'll just sleep, lie down, when I wake up, feel I'm good. It's not every unhealthy condition or a kind of unhealthy sensitivity you feel in your body that will warrant you to just start taking drug on your own, which that is not advisable. And what is called drug interaction. Two drugs come together either to give a beneficial or unwanted effect in your body. This one we have drug interactions. We have example of such drugs. We have augmentin, which most of you know. We have ampiclox. Ampiclox have ampicillin and clozaxilin, and augmentin have clavulanic acid, amoxicillin, whatever. Another drug. We have X-Watch. X-Watch. I think X-Watch have amlodipine, hydrochlorothiazide, hydrochlorothiazide, and one other drug. So these are drug interactions. Drug, they come together to give to give to give effect that is needed for your body. And some of these drug interactions, sometimes when you give one of that drug, it may not be used. I mean, the body may not benefit the effect of that drug very well. So when I'm joining the two drugs together, it makes it, I mean, it gives a better effect than just giving one. And sometimes we do that by helping the patients not to take too much drug at the same time. Just like the X-Watch I mentioned, X-Watch, I think it has 3 different drugs in it. I think amlodipine, hydrochlorothiazide, and I've forgotten the other drug. So they will now compare, they will now join everything in one single tablet. So when you take it, you are taking all those 3 tablets at the same time. So that is drug interaction. Then the last one here, me is last one here with me. Last one here with me is drug resistance. Second to the last, sorry, drug resistance. Now, drug resistance is a situation whereby a drug does not work for you any longer. Drug you are taking is not working for you any longer. And do you know why we mostly find ourselves in that situation? Is as the result of using drug, right? A doctor will say, take paracetamol, just take 2 paracetamol, and you feel one paracetamol will not be okay for you, right? You want to take 3, 4, 5. There are people that even take 5 tablets of paracetamol without minding. You really don't know what you're really doing to yourself. You're just being like an enemy to yourself. It's just like you're using a gun to shoot yourself because it has a negative effects to your health. So such situations also lead to drug resistance. And like I said, drug resistance is a situation whereby the specific drug will not longer work for your system because you abuse it. And we have some drugs that have been banned already in the country as a result of this term known as a drug resistance. So how do we avoid how do we avoid ourselves from encountering this drug resistance? There are some of us, I'm very sorry for the lights. Hopefully we'll get it back. So there are some of us that we don't stick or we don't keep to drug instructions. Take this by so time, do not take more than so dose. No, we feel like we need to take it. See, you need to know that drug is not food. It's not something that you need. You must need it in a larger quantity before you get fine, before you be fine. As little as the quantity is, that is what your body needs. So when you try as a layman, trying to overdo to say that one as big as I am, why will I take 1 gram of paracetamol? You now go ahead. I'm using paracetamol because it's a very common drug that even a child knows right now, which is not going to work and it's not helpful for you. So learn to stick to drug instructions, and that will help us stay away from abusing drugs, and we'll never encounter drug resistance, drug addiction, drug dependence, and all those things. So let's try our possible best to stick to that. Now, let me call back. What are these things that you do that are being termed as abusing drugs? Right? Because some of us are practicing some things without.
I'm guessing the network is right to this thing, but they will soon be live back because it's just hoping, but they will soon be back with us. But I hope you're getting value from this session. I hope you're learning, you're unlearning, and you are learning from this session. I told you there was a lot coming, and I believe that a lot is actually, you're actually learning a lot. Right? It's actually coming. So, in case you have a question, you can just kindly drop it in the comment section, and we'll do well to attend to it while I wait for him to be right back, because network just maybe might kick him out, but he's trying to get back with us. So any moment from now, he should be back with us. Okay, so that is that, and let me try to reach him too. Sorry for the little break. Right. Sorry for sorry for that, and he's back with us. So you're welcome back, sir.
Thank you. We apologize for the network. So let's continue to take our time. So knowledge is very, very important for everything. You need to have the knowledge about how you can confidently do it before we can confidently, before you can confidently. And even that, some people are doing drugs because they don't have the knowledge, and that is why it's always good to consult your medical practitioner before making this drug, any drug. I was telling you, I don't know if it's network and how to later. I was telling you about my experience when I need to do my gas because I don't know. So using the gas burner, without knowing that that gas burner is causing everything that it leads to a fire outbreak. That told me that there was one of the things Why are the people enter the not post? You understand? So now I have the knowledge. Although because I don't know that. And I should have asked. You understand? I should have asked. So now that I know, I have a better knowledge and know how to take care of myself. I mean, how to make use of the gas.
Okay, sorry for that. I don't know, the network tonight is just. For the village we are currently experiencing is minor, but it's under control. Or it is under control. So he will be with us right back. The network is just misbehaving from his own end. But definitely be with us right back. Okay, he's right back. Let me bring him up. He's here with us. Okay, just a moment. So sorry. Sorry for these inconveniences. But I hope you're enjoying the session. I hope you're getting value from what is being shared. So he's right back. And you are live, sir. You can carry on. If you can hear me, you're live. So you can take over, sir.
move on now. All right, so we apologize for the network glitches we've been having so far. Okay. All right. So we're going to continue, right? With the network have made us waste a lot of time. Okay. So I was talking about self-medication. Self-medication is very, very dangerous to us in our body. Are we together? So this is what it does to us. Hope you all will forgive us for whatever is going on right here. Okay. It's not really intentional. We just anything that can happen at any time. All right. So quickly, self-medication is very dangerous, most especially to someone that have zero knowledge about drugs. It is always important that you meet your medical practitioner for whatever reason you're feeling, instead of you just taking the drug into your body. In that drug reaction, I will only talk about drug reaction. We have food drug reaction. We have drug reaction. Food drug reaction, it can be negative and it can be positive. You may end up taking a drug that does, and we have food reaction as well. You heard about, there was a time I saw it, I don't know how true it is, that when you eat egg and banana, it becomes poisonous in your body and it may lead to the end of the, that is food reaction. And there are some drugs too that when you take the two of them, it causes a negative effect in your body. You understand? Because you don't have the medical knowledge of such drugs, you may ignorantly take those drugs thinking that it's going to work for you, but unfortunately, it will be harming you to be doing bad than. So that is why we always advise that you seek for medical attention whenever you are ill or you feel there's need for you to take medication. Do not just take it on your own, but rather seek for medical attention. That is why we have medical practitioners all over the world. They spend years in learning. Imagine someone has spent years in learning on how to come and take good care of your body. You with zero knowledge, you want to take good care, you want to take care of of yourself medically. Do you understand? So you may end up harming yourself instead of. So let me go to my point. I was talking about taking a higher than prescribed drug. So whatever doctor said to you, learn to listen to instructions given to you by your health practitioner. Whenever the doctor said take 1 gram, stay with 1 gram. Take 1 gram morning, afternoon, and evening. Take it like take 1 gram morning and evening. Take it like do not assume that if you do not take it that if they say take it twice and you feel like taking it twice will not work for you, you are doing harm to yourself now. So take it according to the instruction your health practitioner give you. If you are not convinced about something, do not assume the right thing. Since I'm saying if you are guilty of it, you are abusing drug. Layman feels like abusing drug is when you are taking tramadol, taking codeine, taking morphine, and all of that. No, that is not what abusing drug is all about. When you are taking drug against the instruction of your practitioner, your medical practitioner, it is a drug abuse. So for you to be safe medically, learn to listen to instructions given to you by your health practitioner. The next point is using someone else's prescription. Nigerians, I trust, we are very good in using medications that is meant for either our parents or our siblings because we feel like I'm sick. Or probably you are sharing the same symptoms with your sibling or your parent, they will feel like what even your sibling said will not finish his or her own medication, you'll be like, I started taking this drug, I still have the remaining one, but you take it. Drug is not food. We need to understand there's differences between drug and food, right? Even though I said everything is drug, but the differences is the doses. I know I said that, but yet we know food is food and we know drug is food. Even in the there are times that doctors, I mean the medical practitioners only suggest you go take some food and you'll be fine, right? So let us not abuse it. Let's stick to it. If this drug is meant for your mother, let your mother take the drug alone. If this drug is meant for your sister, brother, wife, or husband, let the person take it alone. If you are feeling dizziness and you feel feverish or whatever, go and meet your medical practitioner for a medical advice, treatment, therapy, whatever that you need. Do not take a drug that belongs to someone thinking that it will work because there are some sicknesses that have the same symptoms. You may think it's the same thing that is worrying the both of you. So you may be taking the drug for the wrong sickness. And imagine, imagine, uh, 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 I don't know, imagine using a big hole on the rock. How does it work? Imagine using an engine. Uh, this this engine they use for cutting boots, right, on your body. You know, the engine will not feel like "Ah, this one is not wood, oh, it's human body. I will not cut, oh, I will not work." It works. So the same thing with drug. When you take the drug for the non-reason, for non-medical reason, it does the work that it was supposed to, and it is very harmful to your body. So let's abide by instructions. Our next point is using medication, mixing medication or combining it with other substances without medical guidance. Sometimes they will tell you when you're taking this for like malaria, I'm using some of these common drugs that I use for better understanding and easy understanding. Anti-malaria, we normally do not take citrus or vitamin C. Why putting it? Because it will not work. And that is why you go and you come and be insulting your pharmacy or your doctor or the hospital that are not giving you good drugs. Meanwhile, you are the cause for the reason why the drug is not working. So try as much as possible to maintain is all about instruction. Our problem is we know the hear words. Most especially we in Nigeria, we feel like our own understanding is better. We feel like what we think is the best, meanwhile, it's not the best, and we are doing more harm than good to ourselves. We need to be very, very careful. Let's learn to adhere to instructions given to us by our medical practitioners. If they say, take, there are times that we give drugs like um, anti-ulcers. Sometimes we say two different anti-ulcers, probably Gestid and omeprazole will like tell you, okay, keep a distance of 3 minutes, I mean 30 minutes when you take the omeprazole before you take. And sometimes we'll tell you, take this 10 or 1 hour before food or 1 hour. All those things is not like we're not trying to show you see we suck, you know. It is important that you adhere to it because we have reasons for telling you that. When you don't you do it that way, it may not work for you. So the expected result may not be gotten, but when you adhere to when you abide by the instructions, you realize that your medications are going fine, give you the expected result. We are creating this awareness to help get the medical result that we need, so that we'll be fine and we'll live a very good life in a healthy way, so that we will use our medications in a good way to get the expected result we wanted or we want from the drugs we are taking. So failure to abide by some of these instructions, it leads to either drug dependence, drug addiction, and drug resistance, which is not good to ourselves. Um, our convener, please, if it's my time, you try and call my attention so that I'll not exceed my time. And our next point is using drugs despite knowing the associated risks. We know that some drugs are linked to we know some activities not especially let me say smoking, let me say taking, and we all know that all the things for the brain, it has damage to the brain, to the brain, to the drug. There are situations that lead to fertility attention. So this is just a supplement about the drug is what is that human is that is human in fact human is this kind of this kind of the standard of the when you take it supplement the output together. I would say that so learn how to do things to one about these things that you're given to you by your medical practice. When you always do that, this is when you do anything, you're doing it, when you take it up into this just well, relating to the every and how to make that how all the year, make that really hard. When you go to fix the structures, you don't make the way you are waiting for all of the not be there now. I don't want to put it down to make the money so that I know how to manage it. Um, yeah, of what I think the final to about it. So this is trying to make the more and explain the things that when you try to talk to you have to do so. When you practice all of these now this point need to be people will be supported. The way people know what to do so when you do this what right? How to do it, what you see, this way of not getting depending on the situation. Private also feedback here for people that you here very regular person, they are taking a constant just knowing the damage to cause to what kind we need we all want to live in the application related to body but we are taking exactly what to do. Just like it's coming out there, so the people to do is damage that is exactly what is related to do. Your it's not your liver, using that to take your it's not liver. So what people the kidney making abnormal and it should be on every human origin. So let's try so that now make you to be going to hospital to go and see a doctor people say you are going to because you are abusing them. It's not good for the world. You understand? Very many people
most of these most of these things are being manifest uh, hardly to us in a very nicely to us in our mood other than our needs. Then the next point is it leads to strong dependence and dependence. I mentioned it. Regular and excessive use of certain software can lead to changes in brain chemistry, causing the need to use the drug impact the we are exposed to different dependence. So when we use drug, it leads to either addiction to dependence. You use drug because they know it fits your brain. Your brain is so used that the brain is as a living thing that the brain needs to function very well. So that's why you see some people that take drugs, they don't take the drug, they waiting for months. You know, behave like their brain has help that drug and make it the kind of thing that it needs to function well. So let's get to that. Mental health issues, including drug. See, when you are using drugs, and it get into and it get into the key tendency that you are because you are having a good defense to yourself because the drug has affected it has affected your brain. Those basic functions the normal way to use it. Look at particular people that are into the brain, are into the brain and other hard drugs. Go and take their and look at the ability to so if you are addicted, you should try to obtain yourself to try to obtain yourself to do and if you want to start, it is not going far. So that you don't get it because it will not only affect the man, it affects the generation coming up to learn very, very well. And the next one is social relationship problems. Drug misuse often leads to relationship with family, friends, and cause depression in personal life. There are people that are so addicted to that. In their company, in their place of work, right? The, their enemy, whoever is charge of their boss, will no longer regard them as staff because the service that is needed from you will not have the service because of the effect of abusing drugs like that. So these are some people, that are very healthy. So that is why it's not only affecting you as a person, it's also affecting the generation that is coming from you. It's affecting your children. And it will not be a good thing that you tell your children. This is how I was. Probably the enemy to take it on any day. It's quite embarrassing. So let's try to do that to live where we are taking our work very, very well. So, I'm trying to rush it because there's more time. It is important to know that effect of drug is good for appropriate help. If you're someone that you know, if you're someone and you know someone that is struggling with such issues, we have some treatment, right? We have counseling therapy, support groups, and rehabilitation programs and centers that can help overcoming drug use with appropriate treatment. So if I'm very sure you have a big thing already, always going through some of these things. The good news is that if you work there, we have some rehabilitation centers, we have some support groups, we have some foundations that will help and in helping people to get themselves out of this job. That is going to be further. In conclusion, I would love to say drug abuse is basically drug destruction. It is destruction of the drug being prescribed to you by your doctor. Not in a legal setting. Okay, and drug the effect that you want drug to put in your body is that effect unrespected and you have the expected. But if you want to go by your own meaning that you in the food you don't have to do this and drugs because they are doing this many things that you know expect to learn, even in the community. This is what I believe that we have value and say that God will
Maintain our job. God will help us to be able to
help you work what you do is to do that this can really have it. Thank you very much for listening.
this village and
This is very good. And I hope something different. Thank you very much.
Thank you so much, sir. Thank you. We are so grateful. Thank you for honoring the invite, and thank you for joining us in this session. It was really an impactful session, and I must really state you delivered much value. And yes, if you're not following Mr. Ishaku Gideon Ambaba, you should follow him up. He's not just a certified pharmacy technician. He's a poet, a spoken word artist, a motivational speaker. There's a lot to learn from him actually. There's a lot. I told you I've known him for
Thank you.
over 7 years now. So I can tell you that this guy is rewarded and has a lot to offer. So you can follow him, and he's on Facebook as Ishaku Gideon Ambaba. He's on Instagram, he's on TikTok. Anyway, you want to find him, you can find him there and follow him. All right. So thank you so much, Mr. Ishaku, for the value you shared. And in case you have any question for the audience, please you can send the question in the comment section, and I will make sure I will attend to each one of them individually, and I will also refer them to him for further clarifications. So thank you so much for joining us. We're so grateful. See you next week Friday. This last our last stream for this month, June. June was a successful one, and June in the month of June we talked about a lot, but most specifically on medications. I think we talked about beyond the cure, um, beyond the cure part one, that's medication side effects. We talked about adverse drug reactions, yes, and we talked about drug interactions, and we talked about eating healthy. That was last week, and this week we're running up with medication abuse. What will we be talking about next month? Who knows? But then be sure that we have a lot of speakers coming up who will come and share value with us. And in case you have a favorite speaker that you want us to bring on board, right? You can drop the person in the comment section and let me know, and I'll reach out to the person and bring him on board, right? It's health of live healthy and stay productive. And another announcement is that with time, you start seeing me bringing productivity coaches up here who will come and be sharing tips on how to be productive also. So it's not just about staying healthy, remember it's healthy and productive, right? So that is that, and thank you so much for always joining us. Thank you so much for always tuning to Health Up with Vahrashee. I remain your host, Vahrashee Shakunua, and I say thank you so much and see you next week, Friday. I love you. Stay healthy, stay consistent, stay productive. Cheers to consistent growth. Bye.